We're here this afternoon with Dr. Nick Leonardi, a plastic and reconstructive surgeon at West Cancer Center and Research Institute. Dr. Leonardi, thank you for joining us this afternoon. I know you've only been with West Cancer Center about 6 months, so let's talk a little bit about why you decided to join West Cancer Center and what exactly you specialize in as a surgeon.
Thank you for having me. I was very excited when the opportunity arose to join West Cancer Center. It's an amazing institution with such a rich history of quality cancer care as well as generalized patient care. And as a plastic and reconstructive surgeon, I was already doing a whole lot of reconstructive surgery for various cancer surgeons, including Dr. Shires, one of our head and neck surgeons, and several of the breast surgeons here. And so it just seemed like a natural fit to help offer plastic and reconstructive surgery to those patients. Additionally, I do a myriad of cosmetic surgery, and that also felt like a natural fit. A lot of the patients that I have over time that started as reconstructive patients have decided to do something for themselves and have become cosmetic patients as well over time.
Returning customers.
Yes.
Well, so let's talk a little bit about the types of cancer patients that can benefit from a reconstructive surgery.
It's a very broad spectrum, and really any cancer patient from head to toe. I've done reconstruction for nearly every surgical specialty that exists out there. Of course, some of the ones that I do the most reconstruction for would be breast cancer patients and rebuilding a breast, as well as head and neck cancer patients and skin cancer. Really anyone that has a cancer in an area that will affect either them in a functional way or a cosmetic way, I can offer help for.
So does the cancer removal occur at the same time as the reconstruction, or is that something that has to be scheduled at a later date?
That's a really good question, and the answer is it really depends on a number of factors, one of which is the patient themselves and some of their existing medical problems, and which would be the safest way to approach the problem. And additionally, it depends on the actual type of tumor that's being removed. So sometimes we want to let the cancer surgeon remove the cancer and confirm with the pathologist that everything has been adequately removed before we then restore function. But in most cases, reconstruction will be performed at the same time or around the same time as the cancer operation.
Well, let's talk a little bit about the lifestyle that patients are able to enjoy after a reconstructive surgery.
So, fun thing about my specialty is that once they're all healed up, people have a restored sense of self. We're restoring function. Of course, cosmetic standpoint, making them look the best they can look after a major operation. And that applies to cosmetic surgery as well. So with either reconstruction or cosmetic surgery, my goal is, of course, to get someone back and recovered as quickly as possible and feeling themselves again.
Well, I'm glad you brought up cosmetic surgery. I know that you mentioned you have a really a strong sense of that. So let's talk a little bit about some of the most popular procedures that you perform.
By far the most popular these days are, of course, the mommy makeovers, which are, after having children and the wear and tear that comes with all that and raising children, people want to kind of get back to feeling themselves in the pre-baby body, and so oftentimes that's a breast contouring procedure along with maybe an abdominal contouring procedure. By far the most popular are probably breast lifts or augments coupled with a tummy tuck or liposuction. And then of course, and with social media these days, the Brazilian buttock lift, which is fat transfer to the backside, has become a very popular procedure as well.
Now, what about cosmetic products? Botox, anything like that?
Yeah, so I do Botox as well as fillers and some things like chemical peels. And then we also have some skincare line that we've sort of targeted towards generalized skincare to restore, youthful skin and appearance, and as well as that we've sort of targeted for our patients here at West that may be going through chemotherapy, losing hair, things like that. So we've got products for hair regrowth, eyelashes and eyebrows, and we've put together a nice combination of products from various vendors that target all those issues.
I know it's really important because we want individuals to look and feel their best, and whether we're talking about restoring form and function or improving appearance, it's really interesting to hear about all of the ways that you're able to help both cancer patients and individuals here in the community both feel their best and look their best. So thank you for spending some time with us today, Dr. Leonardi. We appreciate it.